All right, everybody, are you ready? We are going deep today. We're diving into all things menopause and hormone therapy. We've got your questions covered. We're looking at the latest research from up to date, clinical key. Really going to break it down for you and give you the information that you need.
Yeah, because a lot of people are going through this without the full picture, and knowledge is power.
It really is. And there's
Mm.
so many like terms floating around out there that are kind of confusing. It's like perimenopause,
Yeah.
menopause, and then there's primary ovarian insufficiency, and it's like, whoa. So let's just like define these right off the bat so everybody knows what we're talking about. What do they actually mean for you?
So think of it as like perimenopause is that transition time, right? So that's when maybe your periods are starting to become a little irregular and you're like, oh, what's going on? You might get a hot flash here or there. Menopause is when you have officially gone 12 months without a period. Then it's like, okay, you're in a new chapter. And then there's primary ovarian insufficiency, which is essentially you're under 40 and going through menopause. So early menopause, basically.
Wow, okay. Yeah, that's a lot to take in. And it's funny because our research showed that a lot of women start seeking treatment for all of this in their late 40s and 50s, which kind of makes sense. It's like,
Clockwork.
yeah,
Your body's like, okay.
it's time for this new phase of life.
Yeah.
And that's when those hot flashes and sleep problems and mood swings and all of that really starts to kind of,
It's intense for a lot of women.
yeah, it's intense. And one of the things that we hear a lot about is hormone therapy.
Hmm.
And so we wanted to kind of like unpack that a little bit too.
Yeah, cut through the noise a little bit.
Yeah, because our sources were very clear.
Yeah.
Hormone therapy is very effective for hot flashes and vaginal dryness, which, I mean, let's be honest, can really impact your quality of life.
Oh, absolutely.
But here's the thing, and I feel like this is a myth that we need to just bust right now.
Yeah.
It is not a magic solution. It's not going to prevent heart disease, osteoporosis, or dementia. It's not like a magic pill for everything.
It's not, and that's where I think individualized treatment comes in, right? So the Endocrine Society actually recommends, they emphasize this personalized approach because everybody's medical history is a little bit different. Do you have a family history of heart disease, breast cancer, things like that? All of that plays a role.
Yeah, for sure. And speaking of personalized care, Up to Date actually strongly suggests hormone therapy for younger women, particularly those under 60 or within 10 years of menopause who have severe symptoms. So it sounds like, there's this kind of like sweet spot, maybe.
Yeah, and it's that risk benefit analysis that's important.
Risk versus benefit, right?
Yeah, and that brings us to the big study, the Women's Health Initiative, the WHI.
Yeah, the WHI, everybody's heard about this study. And honestly, I think it scared a lot of women away from hormone therapy. So, like, what's the deal? Did it deserve all that hype?
I think, yeah, it grabbed headlines, but you have to remember it revealed risks associated with hormone therapy, but those were primarily in older women. We're talking 60 and up, so not the age group typically going on it for the first time.
So, like, if I'm in my 50s, should I be worried about what the WHI said?
Well, here's the thing, and I think this is really important for women to know. For women in their 50s, the WHI study actually showed a reduction in all-cause mortality with hormone therapy. And what that means is
Deaths from any cause, basically.
exactly.
Wow.
It might even be protective for younger women. That's what that's suggesting.
Interesting. Okay. So that is reassuring. But, even with that being said, Up to Date does mention some serious risks like stroke, blood clots, they're calling it VTE, and then, of course, the breast cancer risk, which I feel like is a big one for a lot of women.
Yeah.
So, like, how concerned should women be about these things?
I think those are valid concerns and you should be aware of them, but I also think we need to put those risks into perspective a little bit. Like, yes, there is a slightly elevated risk, but the absolute increase is small, especially when you're weighing that against the benefits of, like, I feel so much better. My quality of life is improved.
Right, exactly. It's all about finding that balance.
Right. And I think, going back to what we were talking about with the timing, the risk of those complications, the stroke, the blood clots, the breast cancer, it is lower in women who use hormone therapy in their 50s and who are otherwise healthy and only using it for a short period of time. We're talking like around 5 years.
Okay, so it's not like you start it and you're on it forever.
It's not a lifetime thing, no.
Okay, that makes sense. But let's go back to the breast cancer thing for a second because I feel like that's
Yeah, that's a big one for people.
yeah, it's a big one. And Up to Date did mention a study that showed an increase in risk with combined hormone therapy. So what does that even mean? What is combined hormone therapy?
Yeah, so that's a good question. That study found a slight increase in risk, And this is specifically with combined estrogen-progestin therapy, not estrogen alone, and even then. The increase is relatively small in, like, if you actually look at the numbers, it's not this huge jump. And there's so many factors that contribute to breast cancer risk. So hormone therapy is just one piece of the puzzle, really.
So there are different types of hormone therapy out there.
There are.
Okay.
And the risks and benefits are going to vary depending on the type that's used. So for instance, like if you've had a hysterectomy, estrogen-only therapy is a viable option, and that eliminates the risk of endometrial cancer.
And just so everybody's clear, endometrial cancer, that's cancer of the uterine lining, right?
Yes, exactly.
Okay. Just wanted to make sure.
Different.
Yeah, totally different. So it really sounds like, this is the conversation you need to have with your doctor. Like, they need to know your history.
Absolutely. You need to have all the information
Yes.
to make an informed decision.
Okay. So we've covered, like, the big things, the
Yeah.
hot flashes, the heart health, the cancer risks, all that. But what about, like, I'm curious about, like, what are some of the lesser known impacts of hormone therapy?
Yeah, that's where things get really interesting
Yeah. Tell me more.
because both UpToDate and Clinical Key pointed to some like unexpected benefits.
Oh.
Like what?
Okay, so this one's, like, really important, I think. There's evidence that suggests hormone therapy may reduce the risk of colorectal cancer, which is huge.
Wow.
Considering it's a leading cause of cancer deaths.
Yes, yeah.
And it's not just about cancer prevention. There's some thought that it might have positive effects on bone density, mental health, and even UTIs.
UTI, urinary tract infections.
Yeah, urinary tract infection.
Well, wow. I did not know about any of that. The bone health, the mental health. Yeah, and I think people don't talk about that enough. The hormone fluctuations during menopause, they can impact bone density and mental health as well. So while more research is being done, this is an evolving area of research, it does seem like hormone therapy might actually offer some protection against bone loss and even have some mood boosting effects.
Interesting. I mean,
Yeah.
it makes sense, right? Because your hormones are all over the place.
Right, it affects everything.
Yeah, so it's not just about, like, not having hot flashes.
It's about quality of life, really,
Yeah.
across the board.
And feeling your best during this transition, because it is a transition.
It's a transition, yeah.
The whole new chapter.
Right. But it's important to remember, hormone therapy, it's not a cure-all. It's not going to be right for every woman.
Yeah, like we said, if you have certain risk factors or a history of cancer, blood clots, whatever it is,
Exactly.
like, it's not for you.
Right.
So are there other things that women can do? I mean, like, if hormone therapy is not an option.
Yeah, and Clinical Key actually talks about some alternative therapies that are showing some promise.
Okay. Like what?
So there are some antidepressants that can actually help reduce hot flashes.
Really?
Yeah, they're finding that.
Wow.
And then there's also gabapentin, which is a medication that's actually used for seizures, but they're finding it's really effective for hot flashes as well.
Interesting. So it's like they're repurposing existing medications
Exactly.
for menopause symptoms.
Oh.
That's fascinating. What about, like, things that aren't medication?
Yeah, so Clinical Key talks about cognitive behavioral therapy.
Oh, right. CBT.
CBT, yeah. And
So how does that work for this?
so basically it helps you change your thinking patterns and your behaviors around
Menopause and
menopause, around hot flashes, yeah.
so it's not just masking the symptoms, it's like actually giving you the tools
Exactly, yeah, to manage it.
to manage it from within.
To cope, exactly.
Wow, that's really cool.
Yeah, and then of course, we can't forget about lifestyle modifications.
Right, because it's not all about medications and therapy.
Exactly.
Like, sometimes it's just the simple things.
Sometimes the simple things, exactly.
Like, what kind of things are we talking about?
So, like diet and exercise, stress management techniques.
Stress management, huge.
It's
Yeah.
huge, yeah. Things like yoga, meditation.
Yeah, all that good stuff.
Mm-hmm.
Wow. Okay, so we covered a lot of information today, a lot of really, really good information. So let's just, like, recap really quickly for everyone, kind of like the key takeaways about hormone therapy, about menopause, all that.
Yeah, sounds good.
So first of all, I think the biggest takeaway is that for many women, especially those under 60, the benefits of hormone therapy can outweigh the risks.
But, and this is a big but, it is so important to talk to your doctor.
Yes.
Because they can look at your individual risk factors and help you make the best decision for you.
Right, because everybody's different. Everyone's
Right.
body's different. What works for one person may not work for another. Okay, and then another myth that we busted today is that hormone therapy, while it is effective for hot flashes and vaginal dryness, it is not a magic solution for other health conditions.
Right. It's not going to fix everything.
It's not a magic pill.
Right.
It's just one piece of the puzzle.
Exactly.
And then we also learned about like some of the added benefits of hormone therapy, like the reduced risk of colorectal cancer, the bone health, the mental health, even UTIs. Like I feel like a lot of people don't realize that hormone therapy can actually have those positive impacts as well.
Yeah. There are a lot of benefits that people aren't aware of.
Yeah, so that's important to know. And then lastly, if hormone therapy isn't right for you, that's okay because there are other options out there, like we talked about, different medications, therapies, lifestyle changes.
Absolutely. You have options.
You do have options.
Yeah.
So no matter where you are in your menopause journey, remember knowledge is power. Talk to your doctor, do your research, and make the best choices for you.
Couldn't have said it better myself.
And on that note, I think we're going to wrap up this deep dive. Thank you all so much for joining us. We hope you learned something new today, and we will see you next time.